which is a very, very ambitious lecture indeed, but I hope we will all learn something from it. So, Tamonash, over to you.
Respected chairpersons, my friends, colleagues, I really feel happy and privileged to standing before you in this program of safety of surgery organized by alumni of association of our Royal College of Surgeons of Edinburgh. This is really one of the rarest event in my life to stand before so learned peoples. I talk about science of tissue management. This is basically a combination of certain things which we use in surgery. Normally we do suturing, stapling, some energy sources, some kind of hemostatic agents. All together we put is called science of tissue management. Though I will not concentrate on all these areas because it is very difficult to address these whole issues in these 15-20 minutes. I will concentrate on one of the most boring part of these tissue management is energy. So I will concentrate on this energy part. Before I am going to these, we all know the basic surgeries, we go on for resection, for dissection and all these reconstruction. So we need to address these areas of tissue management in resection and all. This is all age-old process of good healing for wounds is by meticulous hemostasis, minimizing tissue damage, maintaining adequate supply and definitely less tissue tension. So when we do dissections, we have a good access to the organ. It must be properly mobilized and definitely have a good hemostasis. How we can achieve this? We can have a good hemostasis by either, this is a natural one is by protein, there's a platelet aggregation and coagulum formations. This is a natural one. Whenever there is an injury to any vessels, the natural reactions will come up and there will be coagulation will started. But in surgery, we cannot wait for major or minor, very minor diameter vessels, which will stop spontaneously. We have to do something externally, and most of the time we can use some hemostatic agents or by electrosurgical agents. And three components of these electrosurgical units, mostly compression, heat and time, which will determine how much effect we will get it. So this is a brief ideas about the time and heat. As the heat will goes on till 49 degrees Celsius, we can have a reversible damage to the tissues, but definitely sometimes we don't get the desired effect by within this temperature. We have to go up, and the time and the level of heat is going up, it can goes up to carbon, and the black areas is a carbonization of the tissue. That also does not help because that will goes off sometimes after. So between these we should have some desiccation or drying the tissues which can be done. These are the all effects, visible and molecular level of effects of the heat on the tissue. There is up to 50, there will be no visible effect, but definitely in a cellular level it starts the necrosis. Then onwards sloughing and ulceration, large crater, then it goes on. And definitely compression together with this heat and time, the time of compression also important because that's also gives support to the tissue and the hemostasis to achieve. Before I go into the detailing of these areas of energy sources, we must have a tissue dynamics, which should be very clear to us. The tissue dynamics in all these vessels, fat, lymphatics is slightly different, so we must have a clear understanding when we put energy to these tissues. So fat have a least amount of O2s. So whenever we put any energy to the fat, that it liquefies. The moment it liquefies, it cannot allow the energy to pass on, the electricity to pass on. So it's really bad for energy source to apply on the fat tissues. But definitely vessels are very good. There is a good amount of water, so that can allow. And between these, even the vessels, the artery and veins also very characteristic difference. The collagen and elastin ratio is very important. So I'll come to collagen elastin ratio in arteries and veins, which really helps. So arteries are much better to coagulate compared to veins. So we should take care when we do the hemostasis in surgeries. So even these one also very important when do, particularly in surgeries. The 5 millimeter vessels sometimes is not really a 5 millimeter vessels if it transect in a oblique or an angle. So particularly this is very important for our laparoscopic surgeries. We have to place the energy source in a proper directions, in a proper angle, so that really a 5 millimeter vessels can get it. And whenever there is a angulations, there is burst pressure will change. So I'll come to that. These lymphatics, I am not detailing these all areas. This is very important of a collagen elastin ratios. The amount of collagen, if is higher in the tissues, that can have a good sealant. It can act as a good seal. So in arteries, it's a better compared to veins, and that can withstand a good vast pressure. Even up to 3 times of systolic blood pressure can withstand a artery if you have a good sealing. A good vessel sealing can withstand up to 3 times of systolic pressure within the vessels. But if you do not have that good seal, particularly for veins and others, sometimes we require to suture or to tie off because the veins cannot withstand up to that kind of vast pressures. Primarily in surgery, we use 2 types of energy sources. That is, one is electromagnetic energy, mostly from electricity that we derive, and that is can be monopolar, bipolar, all these kind. And these are mechanical energy by suturing, stapling, ultrasounds. So I'll concentrate on these electricity. And any energy source in surgery, whatever we use, that should have this ideal one. Though this ideal one is not available, but it should be versatile. In any tissues, in anywhere we can use it. We can use it for a multifunctional purpose. It should cut like a scalpel, so that you can get the fastest cutting. It should seal. The moment we cut, it can seal. No bleeding, so we'll be happy. Minimal tissue injury, minimum tissue injury, and there should be minimal charring, so that after surgery also there will be the tissue will not goes off. So this is and definitely should be safe to the surgeon as well as the patient, and definitely should be cost effective. It should not be a machine which is really we cannot afford. So all these criteria should be ideal. Though the ideal machine is not available, but we should consider these issues, and it should be balanced between the cutting and coagulation of the tissues. Now I'm considering the electrosurgical units, and what we use in electrosurgery, it is absolute the electricity through a generator. Electricity through generator just changes the frequency of the electricity. In our household energy, I'll just give you one slide more, where we can show that what household energy is approximately 60 Hz only, the cycles. And in surgery, we use from 2.5 to 3.5 kilohertz, so that the tissue above 1 kilohertz, it means 1 lakh hertz, tissue cannot depolarize. The cells cannot change so that there is no effect on the muscles or tissues if we put on that electricity, and the generators will do this job. So there will be no cardiac fibrillation, nothing. But normal domestic electricity can cause cardiac fibrillation, muscular fibrillation, all these. This is brief history. It's a combination of a physicist and a surgeon who really invented something which is really we are enjoying now in surgery. Now brief about some physics of surgery, some energy sources. This is the resistance which creates the heat. The moment the tissue have a more resistance, and if we look at between the blood, nerve, muscle, fat, the tissues, these are fat and bones have more resistance, so create more heat. So when we apply on these tissues, we should take care of lateral burn and other injury to the other organs. So creation of heat is important in these tissues. This is another phrase. So if the normal pathway of electricity is blocked, suppose we are putting some energy in some tissue which is not passing through the electricity, it will take an alternate path, same like a water flow. So we should take care of these. And another part we should keep in mind when we apply any energy source, the current density. The simple thing, the active electrode in our hands, which is we are applying on the patient, that is the maximum current density because of the surface area, the area and the energy. The same electricity coming back to the generator to a passive plate or the patient plate, same electricity but without any problem or the area where the electricity is coming out because of this current density. So we should always brief about this current density. This is the frequency range what we normally use in surgery. Below between 2 to 3.0 kilohertz normally we use in surgery. Sometimes, sometimes the gynecologists use the electrocautery. I must have one word about electrocautery. In electrocautery, there is no electrical circuits. It is absolutely a machine or an instrument which is heated by electricity. Same thing like heat. It's just created a heat, and that heat applied to the tissue. Sometimes for a cervical tissue or somewhere they put this cautery. There is no electrical circuit in cautery, but in electrosurgical units have electrical circuits. So electric energy delivers to the patient and come back to the machine. This whole circuit is completed in electrosurgical units. This is a basic difference of a cautery and a surgery. So basically these three kinds of things we use in electrocoagulations. One is cart, coagulation, blend. Before that, I must have something about monopolar. Monopolar is something which we applied active blade, and that goes to the machine through a circuit, through a passive blade. So it's between the patient acts within the circuit, and there can be and this is the current density. If the current density in the patient plate is higher, so always we should check and we should train the OT personals who will put this patient plate in properly. Otherwise, the current density of that area will be higher and patient can get burn on that area, alternate areas burns. Safe use of monopolar should be, these are the things to follow, that it should be short burst, tip should be under vision in laparoscopy, but only a tissue contact, never in open, because I talk about open circuit and closed circuits. So it should be safely used, and definitely all instruments should be checked for its insulation, very specific for laparoscopy when you use it, any electrosurgical units. This is bipolar. These both the blades acts as electrodes. One blade deliver the energy, another blade take out the energy from the tissue. Between these two blades, the energy will be acts. The tissue between these two blades will act on the and have the hemostasis. These are bipolar coagulations used since 1940, long back. And most of the time in bipolar coagulation, we have a least amount of energy is required. Because of the two blades only, the amount of tissue as well as the area is very small, so energy amount is less can act. There is a less smoke in bipolar, it's an advantage, and definitely it's a least tissue damage in bipolars. In a vital structure areas, it's better, we can use it bipolars, and definitely it's safer for those patients. We cannot use the monopolar because we cannot keep the patient on a circuit like in the patient have a pacemakers. With a caution, sometimes we can use it, but ideally we cannot use the monopolars for a patients have a pacemaker. We can go for a bipolars. These bipolar coagulations, always we should allow some time to bipolar tissues to cool. So one burst, then wait for a few minutes or certain 2-3 seconds. Again we can, so the tissue can cool and heat, so that these can coagulate properly, desiccate properly. So these are safe uses. Clean the crust always, because these are two blades only that deliver the energy and take up the energy. So blades should be cleaned, hold small bits of tissue, power setting should be low, so you can give a good effect. And what these actions of these energy? Most of the time we use these terms: cutting, fulguration and desiccation. Cutting is a non-contact electricity. Take it, we should not touch the tissue if we use really properly a cutting current, pure cutting current. It does not require any touching the tissue. It is the bombardment of the electrons which immediately goes to the tissue, and there is the cells get swell off, burst, and it just goes up. So it's a cutting is a non-contact, and if we look, these cycles are continuous and higher amplitude. So cutting current is a continuous high amplitude, goes non-contact. If we go to the fulguration mostly is called a spray kind of diathermy, spray kind of electric source. It's a small amount of air between the tissue and the active electrode that get electrocuted, that get energized, and that hits on the tissue, and a wide area can get fulgurated by spraying modes of these. And when we did this desiccation, it's a contact, and active cycle of these contact is hardly 4%. So there is a active cycle and there is a non-active cycle. It's a contact. The moment of active cycle, tissue gets heated, and when there is a non-active cycles, there is cooling of the tissue. So between these, it gets heated and cooled. So it gets the water dried up and the tissue get it. And most of the time in these coagulated, we must have to cut by mechanically by scissor or something. And combination of these two of cutting and coagulation can be 50-50, can be some kind of combination. We can do it by the dependence on the machine. This is a blending. So we can have this blending, depends on which tissue, which organ we operate, we can do it. And something about this circuit, this closed and open circuit. Sometimes I have seen the surgeons are using their business tee for the active electrode. Without touching tissue, they are putting the foot pedal on. If we do it in a coagulating current, what happens? The machine will try to pump up, because he thought that the resistance of the tissue is very high. So it just goes, the voltage goes up. If the tissue is not touched and the foot pedal is on, machine is on, means machine will try to give the energy as much as possible. And the moment it touches the tissue, there is a flash, there is a storm, there is a blast. So never we should use the without touching tissue, we cannot activate the machine. There's a real precautions because we are keeping a open circuit. And closed circuit, when we touch the tissue, machine is on, the circuit is completed, so it is closed. So electricity delivers in the energy delivers in the tissue, come back to the machine is very happy. But if we do not do that, if the circuit is open, we will really in trouble. Something about the generators. These are old generators are grounded itself. Whatever energy delivers, they don't bother. They grounded. So these generators are very dangerous. There is a chance of alternate side injuries. But now recent generators, now new machines have a isolated newer generator. The energy delivers to the machine, that should come back to the machine, otherwise they will not deliver further energy. So these circuit to be completed, so these eliminates the isolated areas or other side areas injuries. So altogether electrosurgical effect depends on the temperature which generated, shape and dimension of the probe because of current density, distance from the electrode, tissue resistance, and definitely power and amplitude of the current. Altogether the whole effect will come out. Now we look some complications. Lot of complications can happen because of this energy. And I just giving this one of the really dreadful complications of a ground pad failure energy. Ground pad failure, there is a burn in these alternate some areas where ground pad is there. There can be injury to the, like a current density, same thing. If we apply dissecting the testicles with this energy source, in the cord it can get there's a higher current density in the cord and it can have a thrombosis. So, and sometimes in a laparoscopy we have seen there is some adhesions with the gallbladder and the duodenum. There's a very thin layer of attachment. So always should be close to the gallbladder. If that energy is passing through the duodenum with a small amount, the current density of that area will be higher. We inadvertently sometime one day after patient will come back with the duodenal perforations. So we should take care, we must have a roadmap in our mind. If we deliver the energy, which way this energy will come back to the machine. So we should have a plan about that. So when we apply our energy sources. These are another complications of a demodulated current, but recently available, most of the machine does not do these. This is the machines which do not have that filter. Sometimes the machine can develop the energy which is below these 2 lakhs of hertz. So what happens if there is any kind of energy is developed below 60 hertz, or 60,000 hertz, so patient can get electrocuted. So this is the recent machine all have this filter, so they can protect these demodulated current. This is one problem. A lot of people of us, we are using local diathermies which does not have these kind of protectors. In laparoscopy particularly, this kind of problem may come up. This is capacitance coupling. This sometimes whenever you use any electricity like this power cord which you're using for charging my laptop, through this cord, even it's insulated, there is some kind of electromagnetic field is created around it. And if we apply a electrode through these metallic sleeve and putting a rubber or a plastic trocar, what happens? Normally, if the trocar and the cannula both is metal, then what happens? These electrode, what we use in laparoscopy, that get the static electricity which generated, that will pass through the tissues because of the metallic trocar. But if we put a plastic trocar, then and putting a metallic sleeve, what happens? Like these, what happens? The static electricity cannot disperse. So it just gradually goes up. And what happens? Sometime after that will, whenever it comes to touch to any tissue or somewhere, there is a electrocutions. So there can be burn. So what we can protect, if we really interested to do these, that we are using the plastic trocars and the metallic sleeve, the best is sometime after we should take out the metallic trocar and rub it with the patient with the grounded. The static electricity should be grounded, means sometime after in a cycle, so that this static electricity will not goes up and do like this. It can happen like this. It can touches the tissue and can have a burn. Sometimes in the laparoscopy particularly, there can be insulation failures of the instruments. We have a 4 zones. The zone 1 which is under vision, and this is most safe areas. In the telescopes, in a laparoscope, we can see this area. This is zone 1. So anything happened there, we can look that what happened. Zone 2 is most dangerous. It is between the trocar and the cavity, beyond our vision. It is beyond vision but within the cavity, within the abdomen. So any insulation failure in zone 2 can cause any injury which is beyond our knowledge. And zone 3 is within the trocar. If it's a metallic trocar, that your insulation failure can deliver the energy and it can pass off. But zone 4 failure is electrocuted for the surgeons. If any failure in zone 4, surgeon can get electrocuted. So we must always check this zone of these all instruments of laparoscopes which we use that delivers the energy should not have any insulation failures. Sometimes this kind of problem may appear. It's absolutely clean surgery. Maryland Athens is using with the energy source, is a gentle and using this energy. But you see, when we putting this energy, the blade is activated, we should be very cautious. It should not touch beyond our desired areas. So if we really activated this blade and because of gentle certain pulling, it just goes off, and what can happen? It can injure the cavity. You can look, there is an injury. It just touches. One touch is cause this injury. So we should take care of these kind of things. Now I'm coming some vessel sealing systems like Rigashore. I am not detailing these parts, but at least we must have a brief ideas that vessel sealing systems now available can have up to 7 millimeter of vessels that can seal. So it's really a good machine which we can use it. And N-seal is one of the two blades which is N-seal is using. These two blades is a blade technology. One side I can say both the blades with a millions of smaller areas which delivers the energy between the two blades. It's a bipolar. Between the two blades of millions of areas they can deliver the energy, and smaller areas of each areas there's a coagulation, and the moment it's finished there's a machine will get a signal and it can cut through. It's really good to do this. So now I'm coming to only ultrasonic energies. I am not detailing this part. I think most of our friends knows about ultrasonic energy. It's very popular in a lot of science. This is a mechanical energy we use it. Electricity goes to the piezoelectric cells, it's a vibrating to up to 55,000, and the moment it goes vibrating, that is transmitted to a metal to the patient, and there's ultrasonic energy delivers. So this is what happens. Basically, it's just because of these mechanical vibrations, there's a hydrogen bond breaks and protein deorganizes, and the moment it happens, the protein coagulates some seals and collapse the vessels. And there is a certain gravitational effect of ultrasound also, which can create the areas. So this is ultrasonic energy which you use, and with these machine there is some nodes which is really propagating these ultrasonic energy after the tissues. And how we can get best use of these ultrasonic use by it's a power setting. There is there is 1 to 5 levels. One side is fixed, other paddle is for 1 to 3. So we can 1 to 5 we can change. So as the power setting is higher means it's a cutting is faster, coagulation lesser. I think this is a very well known machine, and almost in all surgeries people are really fond of using this machine. And how we can get a safe use of this harmonic? Keep vibrating blade away from our vital organs. Don't think that the vibrating organs, we cannot see the vibrations, but it should be away from our vital organs. If it touches, means there is injury. So we should be away. Always remember posterior edge of the blade can also cut. Means when we put it, when you touch, I'll show there's some good videos. It just touch the blades. Both the sides is cutting. It's not that between the blades and the holding areas only. The other side also it can cut. So the active blade should be away from any tissue which you do not want to cut. So that's the precautions you should take. And sometimes there is a slight lateral burn can happen. It goes up to 60 to 70 degrees Celsius temperature in harmonics, but it can slightly lateral burn. So we should take care of these. Even if it's a mechanical energy, slight heat generated because of vibrations. So friends, I just want to conclude by saying this. There are a lot of machines, a lot of energy sources available in our theaters. We should choose which is really comfortable when we really want to do something surgery. And if we have ideas about the tissue, we have ideas about the energy, the weapon, I think we can use it the best possible in any surgery. This is the brief about science of tissue management. Thank you very much. Thank you.